So I really think that having these apps at the beginning of the curriculum and showing the students how to leverage the content, kind of helping them take peeks into the content as you're looking at the brain in gross anatomy, perhaps looking at balance tests. I think those little bits of clinical context really enhance and really draw them into the learning experience. So really, some of these apps allow the students to get a 50,000-foot view. So I'm going to show you in the ortho app what I do with the students every week. So this week, I'm going to go here. I'm going to talk about shoulder pain. So on Tuesday, my lecture day, I saved the last hour to talk them through the most common conditions. So this is shoulder. We went just through body guy, shoulder, and we could play out pain patterns, because that's how we teach them when they do their exam, even though we know that the pain pattern isn't predictive of any particular diagnosis. Or I can use all diagnosis. So all diagnosis gives me a quick access to all the conditions that are in the app. You can see that red flags are built in, so common red flags to watch out for. And if I were talking about frozen shoulder, for example, I would ask them, guys, how many of you have seen someone with frozen shoulder? And I let them talk about what they have experienced in their past. I think it draws them in and it validates their previously known knowledge. So it doesn't matter if somebody's right or wrong because I can clean it up, especially as we watch the patient. So here's prevalence data. We can look at prevalence. We can look at a video of the patient.
Shoulder pain with mobility deficits or adhesive capsulitis.
Notice how I'm linking the pathology to the guideline-based ICF category. Okay, I think that's really important because the students will hear me talking about different problems with mobility deficits, let's say hip pain or knee pain or shoulder pain. And they have consistently learned that when I talk about mobility deficits, the cause of the patient's functional limitation is that they have a lack of mobility. So they automatically know that the examination is probably going to be range of motion related, and the intervention is probably going to be stretches, mobilizations, things that enhance mobility. So the terminology begins to create a consistency of thought. Then I'll ask the students, hey, so this is a mobility deficit. What do you think we're going to do for the exam? So they'll kind of reach back into their past experiences and go, oh, I think we're supposed to assess range of motion. Perfect. That's what we're going to learn in lab. Physiologic range, active and passive range of motion. Here are your videos. And we're going to look at accessory mobility as well. And by the way, these are clumped together. I want you to think when you're assessing glenohumeral joint range of motion that you are going to be looking at physiologic and accessory mobility. I mean, these clumps were built by design because when they can group things together, it helps them to manage and as well as access things that should be linked together. I would also have you note that there's a clinical reasoning video that our students watch. Here's what you kind of watch out for patients with mobility deficits of the shoulder. This is usually what the examination looks like. And throughout the app, we have added movement faults that might be relevant, things that you might see that are abnormal, shoulder elevation with an early shrug. Here are some associated impairments. This patient might have excessive thoracic kyphosis. You want to keep an eye on that. And here's some differential diagnosis. If the patient has a positive upper limb neurodynamic test, they may be having a nerve component to this problem. Or if they're having problems with rotator cuff, MMT, they may have a component of rotator cuff pathology in this problem. So you can see how widespread this tool can be used. It really is up to you how deep you want to go. And then I'll ask them, hey, by the way, what kind of interventions do you think we would do for this patient? So here's the interventions. Here's the outcome measures. So they would say, oh, I've seen people doing pendulums. Great. Doesn't that enhance mobility? Yes. Oh, what about for someone who's really painful? So what we tried to do is stratify the treatments based on irritability so that students didn't just go cranking on a shoulder that was highly irritable. So here are some very easy easing things that you can do for someone who's really irritated. Grade 1 or 2 MOBs, some gentle easing rotations of the shoulder. And you can see that the therapeutic exercises for mobility are very similar. High irritability exercises like pendulums. Or moderate irritability, I can start using my cane and pulleys. And then lastly, I would just say that you can always see that we have tried to link the outcome measures. Here are the outcome measures, and if they are available freely on the web, I have linked them here. And you can also see that we have tried to link the guideline recommendations all here. There's also patient education. So this kind of teaches the student, here's some things that they could say that will help the patient understand what's going on better. So this is written for the student to learn about what to say. What's going on, how long it will take, what we're going to do in therapy, and what you can do to help yourself. And we have also linked JOSPT's patient perspectives here if the student wants to share this with the patient. This is one of the new features in our patient education app that we have just released. So here you could say, oh, I have a patient with frozen shoulder. She's worried and wants to learn more about it. Great. Well, I have a patient-centric education piece, a short video that tells them they're going to be okay, a little bit of evidence-based information with some basic exercises of how they can help themselves. This can also be now emailed directly to the patient. So we have basically an article for all the common conditions, and whatever articles are available in JSPT, the patient can just scan it with their phone and get it.